IL Cafe. We have you covered.
The end of September sees us observe World Heart Day. It's a good time to focus on your health, on the lifestyle choices that you're making, and indeed on some of the other aspects of cardiovascular wellness. Welcome to IL Cafe. My name is Sheetal, and today we've decided to catch up with two experts to help us understand a very important topic, and that topic is CPR. Now, you must be wondering, what is CPR, right? Well, you've seen it. And I have to say, unfortunately, in this country, a lot of us have only been exposed to CPR on screen, on cinema, or some, television serial, that sort of a thing, where we've seen a person deliver cardiopulmonary resuscitation to a patient in need or someone in need. But the thing is, what is fortunate is that there is information available on what CPR is. It's only about connecting the right experts with the right information to the right audience. So we're going to talk a little bit about CPR today on our World Heart Day related podcast. It comes ahead of the day itself. And who are the guests who are going to be joining me over here? Well, our guest speaker today is none other than Dr. Ravneet Vilkhoo. He's an anesthesiologist with a diploma in critical care, more than 10 years of experience in ICU as a specialty and critical care. And he heads, in fact, critical care for Surana Sethia Hospital in Chembur in Bombay. So that's a little bit about Dr. Vilkhoo. And there's also our guest from the ICICI Lombard world who's joining us, Dr. Sharma, I should say Dr. Akash Sharma. He's as you guessed it, a doctor himself by education. He's also an ex-entrepreneur and someone who has a deep interest and experience in healthcare tech. So that is going to be a big part of our chat on the show today. He currently leads outpatient health products, wellness, and the IL Take Care application strategy for the organization. Thank you so much to the two of you for joining us on IL Cafe today. Welcome to the show. How are you?
Good. Thank you.
Good to know that the people in charge of other people's health are good. It's always a good thing to hear that. But my first question for you is for you, Dr. Vilkhoo. We've heard so much about CPR, right? That phrase or the abbreviation is now not a uncommon one for all of us. Why is it important for us on this special podcast to be aware of what CPR is all about?
Well, that's an absolutely good question. First thing, CPR or cardiopulmonary resuscitation, it's a life-saving technique.
Mm-hmm.
It can be used when somebody's breathing or heartbeat stops suddenly.
Right.
So it's a combination of chest compressions and rescue breaths which can be given at a specific time. And, it can restore the vital organs with the blood circulation, and it can increase the chances of somebody surviving a cardiac arrest. So CPR, basically educating people about it, it generates awareness and people can be first responders in such kind of situation. Mm-hmm. So this bridges the gap, till, the pros arrive at the scene.
Mm-hmm.
Basically, cardiac arrest can happen anywhere at any time to anybody. So, nobody is out of risk in today's world. So basically, learning is very easy and accessible to all. Being ready to use CPR can make a massive difference in a crisis situation.
Yeah.
And mainly, it makes common people a hero at that moment. So yes, it is very important to save somebody's life by giving CPR whenever there is a event or whenever there is a cardiac arrest.
When you say anyone can actually learn CPR, do you really mean that, or do I have to have some sort of a medical background to be able to administer CPR to someone in need?
So CPR has two components. It has a basic life support and then advanced cardiac life support. So when you talk about a basic life support, anyone with no medical background at all can learn it at any point of time. It's just a single day's course, a few hours into it, and you are an expert.
No, I absolutely agree with Dr. Vilkhoo on this, and I believe the golden hour is what we refer to. And I believe in a country like in India, where the health assistance doesn't, or emergency health support doesn't come immediately, accessibility is a challenge, more so in a tier 2 and 3 cities. It's good to have somebody around us who can administer this or save life, or ourselves being knowledgeable to do this to the people. I believe through this initiative, some people get that benefit. Look forward to that.
Right. Yeah. So I'm going to come back to you, Dr. Vilkhoo. Tell us, what are the various steps involved in CPR to somebody? What do you do when you find yourself in a situation like this?
No, absolutely. CPR is just a series of steps. So make sure that the person who's in cardiac arrest is lying flat on a hard surface. So place the peel of your palms on the lower middle part of the chest bone, you know, and start with your interlocked fingers. So, then you can start compressing the chest. The compressions should be at least 2 inches deep and 100 to 120 in a minute. And we just have to make it sure that after every 30 compressions, we have to give a rescue breath, 2 rescue breaths.
Okay.
And when we are giving the rescue breath, we should be sure that there is a chest rise so that we know that the breath is going inside. Now we have to just repeat it till the paramedics or the help arrives.
Dr. Sharma, anything that you would like to add?
What Dr. Vilkhoo said, this is more referred to as 3 C's or 5 C's of CPR itself, right? So that means check for breath and consciousness, and then seek help or check for help. Third one is cover the nose and the nose, and then the third one, last one will be to administer compressions.
Yeah.
Right, so that normally is how the CPR normally, in simple sense, to understand what are the few steps and how you need to go about it, is kind of taught or educated.
Yeah. So there you go. Our experts have given us an understanding of the steps involved in administering CPR or cardiopulmonary resuscitation to someone in need. Hopefully that moment never comes in your life and everybody is safe and healthy. Again, wishes on the occasion of World Heart Day that comes up later in September. But to move into the next question, right, Dr. Vilkhoo, we still notice a lot of people who are a little bit apprehensive when it comes to, getting into the groove of action, doing the right thing and saying, okay, I know CPR and I can maybe, help in some way. They hold back a little bit. Why do you think this is the case with some of us?
Well, that's an excellent question. There are several reasons. First of all, I would like to say that it's a fear of making a mistake or causing any harm. It's like when you're giving CPR or chest compressions, there is always a possibility of breaking a rib. But breaking a rib is still better than not doing it at all. And secondly, maybe many aren't aware that how crucial CPR is and how easy it is to learn.
Yeah.
So thirdly, some people hesitate to step in during emergencies, often due to feeling powerless or anxious. So these things are abolished when you learn CPR. Once you know it, you can jump into the situation and be the hero that the person needs.
And where does one learn? I forgot to ask you this. I asked you for steps very smartly. I did that, but then I forgot to ask where does one learn this, right? But how does one learn to be a first responder? Are there courses that are available in this particular area?
There are courses around. Like I said, BLS, Basic Life Support. So there are few institutes which teaches such courses, and it's a single-day course. So you can just check it online and find the nearest one to yourself and get enrolled.
Yeah. Please make a note, all of our viewers on this particular podcast, if there is a skill that you really want to pick up in the year 2023, and there aren't too many months really left of it. Soon we're going to be making resolutions for the next year, but we're not there yet. We still have a few months, and like Dr. Vilkhoo said, it just takes about a day of training, and then you can go back for a refresher course as is required. Let me come to the next question that I have for you. With respect to anxiety, you've addressed it, right? How do we motivate people to learn CPR and also overcome these hesitations?
So education and awareness are the key. We need to spread the word about the importance of CPR and how straightforward it is to pick it up. Offering CPR trainings in schools, workplaces, communities, it can make a huge difference around. Plus legal protections like a Good Samaritan Act. Whenever a person helps somebody who's in cardiac arrest, should not worry about the legal implications of it. So if people are protected in that sense, I think they will jump into the situation and try to help somebody.
Absolutely, and be the hero of the day. Dr. Sharma, what about
you?
So I would say that the main aspect is awareness and education, and I feel that we don't emphasize that enough from our. Probably this should be something that should be taught at school level or high school level at least. It's a good skill. It's something that's very useful because event can happen with anyone, with any age group. Right? It's important to understand how to do it. It's important to when to do it, and also more important to understand how to do it correctly. Yeah. So all this can be covered in a right setting, and I think we should start at the school level at least or college level to build more consciousness around the CPR and its value.
Absolutely. I can't agree with you more, right? In fact, when you look at the broader financial awareness space as well, a lot of experts that I've spoken to on typical money matters related things also say, why don't we start this sort of thing early in life? And same thing with life-saving skills, indeed, as you rightly pointed out, needs to be part of the curriculum. And it's not that difficult, I would imagine, to implement one of these as a subject in schools and colleges. But let's come to something else that you seem to be very, very passionate about, technology and healthcare coming together in one person, and that person is Dr. Sharma. So tell us about, we have something very cool over here at ICICI Lombard, the IL Take Care app. Can you tell us about this one-stop wellness and insurance solution, if I may call it that?
So the I'll Take Care application, it comes from the stable of ICICI Lombard, and we are the number one private insurance company of India. We have built this platform with an idea that it should give users enabling tool in which they can assess their health. And considering cardiac health is one of the key area and one of the major risk for us as a nation, right? Where the lifestyle diseases are the highest. This face scan tool basically plays a very good role in that. So the feature of the face scan is such that if you have the application, you can just scan yourself for 30 seconds, scan your face, and it give you some primary risk indicators about your cardiac health. Right. One would be your blood pressure. It will give you something about your oxygen saturation, but it also gives you something about your cardiac variance. Right. It's an indicator, as Dr. Vilkhoo will also tell you, that it is an indicator that helps you understand that how receptive or how sensitive is your cardiac function vis-a-vis the stress that you have. Now, the stress could be an active stress or a passive stress, and it can lead to all sorts of events. And unfortunately, but in many cases, it can make an individual recipient or a likely recipient of CPR itself, the subject matter that we have here. So we feel that this is something that we brought out. It's a CDSO certified feature it is, and something that people should have in their pocket and should use it often.
I completely agree with you, and this is the day and age of technology coming, or inserting value into our lives in spaces that we didn't believe could be revolutionized by technology at all. And Dr. Vilkhoo, I'm sure you've seen this, right, amongst your patients who are whipping out. Of course, there's always Google. Dr. Google is always consulted before Dr. Vilkhoo. That must be a thing that really annoys you. But we have to live with this sort of reality. But I'm sure you're also sort of gladdened by the way people are adopting technology to stay fit, whether it's a Fitbit that you're wearing or any wearable device, CGM. Nowadays I see a lot of people who don't have diabetes and yet want to figure out what their blood sugar picture is all about, so they implant themselves with one of those devices. Right. Tell us what you think of this coming together of something like like an IL Take Care, an app with technologies like face scan built into it, and people being able to focus on their own health.
Well, certainly the face scan feature is a standout aspect of the IL Take Care app. It lets the user check their key health vitals in a single face scan. Like Dr. Sharma also said, 30 seconds and you get all your vitals in your hand. Right. So it's a quick and easy way to monitor your health on the go. So I guess in today's technological advancement, health should also be one of the priorities, and this health field should also advance in the similar way. So this does help everybody around to get healthy and with the monitoring that they need, I would say.
Absolutely. I can't agree more with you. Things like face scan are truly of value. Instead of watching Netflix, watch the face scan that is available on the IL Take Care. No comment, because I'm constantly watching Netflix myself. So please go ahead and enjoy, but you know exactly what I mean. Dr. Sharma, to come back to you, right? Some of the other benefits and features, if you can highlight about the IL Take Care app, that would be great for our viewers.
So apart from the cardiac function monitoring that face scan offers, we also have certain other features that help in self-assessment. For example, we have a HRA, which helps users, and it's a very effective way of user to engage with the application and tell about what the things they're doing right and wrong and get a score out of it. And also, apart from that, there is a doctor assistance that is their nutritionist. So it's basically a whole ecosystem centered around people living a healthier life, with all the coaches, experts, and assessment tools that can be enabled through a digital feature, such as tracking your steps if you want to track it through the application. Also, a mental coach and counselors we have on the application. So a whole host of that thing created and curated for some of our policy holders. And even if you're not a policy holder, you can still go on an application and use a tele-doc feature, speak to our doctors, and seek a consultation. So that's something we kept open, and even the face scan is open for everyone. So the application is there for people to access and use, and we'll be happy if people take benefit of that.
And something comes to mind. On an earlier IL Cafe episode, I remember one of our leaders in the organization has spoken of how this is more about the health of the individual. This is not really about the insurance aspect, the product aspect of it really, comes much later. So I love the way the focus is really on the individual and them taking their own health and lifestyle into their hands. And then thinking about insurance is just one of the things that happens in the course of that mindset that we're trying to develop, like focus on yourself.
Absolutely.
Right?
Absolutely. So the intention about I'll Take Care is that moving with our relationship with the policyholder, moving not just as a facilitator of risk coverage, but moving as a custodian of care for them.
Right.
And I'll Take Care basically becomes that hub that offers all those enablements and engages us with our policyholder in that light.
I'm going to wrap up. We've spoken quite a bit about the I'll Take Care app. We've spoken about Face Scan. We've had Dr. Vilkhoo's views on tech and healthcare as well. With one last message from the both of you, since you're experts, and Dr. Vilkhoo, you're indeed someone from critical care as an area of specialization. Is there a message that you'd like to leave all of our viewers on the occasion of World Heart Day? We do know that cardiovascular illnesses are, one of the number one killers in this country, along with diabetes.
Right.
A word of caution, something on CPR, would be good to get some words of wisdom to wrap up from you.
Well, at the end, I would just like to say, in today's world, you have to take care of your heart. You cannot take it for granted, and age is not a factor as of now. I've seen people with the age of 20 also dropping dead. So one should, learn and know CPR so that they can offer it. Okay, you can offer it to somebody you don't know, but if there is a condition or situation in your own family and you are unable to help it out, that guilt stays for a very long time. So take care of yourself, give your health a priority, use the health apps, I'll Take Care app is there to help you out with things, and learn CPR with either a professional training or at least take a course or see how it's done on the internet if you don't have time to go anywhere. But learn this important tool and let it be there with you at every point of time.
Absolutely.
Anything, Dr. Sharma, you would like to add?
So thank you, Dr. Vilkhoo. So I think I'll second what you just said, and I believe that CPR, what we're focusing on right now, more and more people should make themselves familiar with it. Understand that the help is at that particular time. The help is only going to be coming from the person next to you, and that person at that time, if you did fail to take initiative to make them aware or educate yourself for it, then at the end of the day, you should share the partly of a blame if you missed out on that golden hour. Right? So it's important for all of us to definitely be aware about CPR.
Yeah. And thank you to the two of you for joining us on the special podcast, on the special episode, in fact, around World Heart Day. And I want to say something to you, which on behalf of all of our viewers, I would imagine, most people in the healthcare space never get told, they get asked for advice. First person to call if you have a doctor in the family, Dr. Vilkhoo and Dr. Akash Sharma must be very aware. On speed dial, I have a cold today, can you tell me what I should be taking? No matter what your specializations, I've seen that happen to doctors in the family. But please do take care of your health as well. And thank you so much for the great work that both of you do in your respective fields for the health and well-being of each one of us. Thank you for joining us today.
Thank you for having us.
Yeah, thank you.
Thank you.